Good morning, or whatever time of day it is that you're watching this. Um, my name is Lauren. If you're new to my channel, I am just going to be posting an update today. This week I hit 20 weeks in our pregnancy, so that's been a really cool and exciting milestone to reach. We had our anatomy scan. So I'll have some details from that and just like overall changes. I think the last video I did, I was 13 weeks. So it's been a good couple of months, just about. And so I figured it was time to do an update. So here I am. Again, I apologize right off the bat. I am still dealing with this shortness of breath that I was having in the last video. So I tend to need to take like breaks in my breathing. And I asked my OB about it. Apparently it's normal. I don't know. I think it's just going to be something that stays with me for the rest of my pregnancy. Probably even more as my belly grows and stuff more. So anyway, 13 weeks was my last update. At that point I had just started, I kind of just got really good at using my Doppler at home. So I was able to find the heartbeat at home, which has been really reassuring. I personally recommend it to anybody that's pregnant because waiting these long periods between ultrasounds and appointments can be really stressful and anxiety inducing. So for me, the Doppler was just a way to I don't know, it calmed me. Like, as long as, even if I couldn't feel the baby moving, I would just hear the heartbeat and I'm like, okay, we're good. Because, even if baby's moving, baby moves starting around 9 or 10 weeks usually. And you can't feel it until they're big enough. And so that's an update I have. So I'll just kind of go through and talk about the weeks, what different changes occurred. So week 14, it's going to be hard for me to remember, but week 14 through about week 17 or 18, I want to say, probably week 17, pretty much was the same for me. It was kind of like the gray area of pregnancy where I didn't really feel super pregnant anymore, because I wasn't really feeling morning sickness. My boobs weren't as sore as before, and I couldn't feel the baby moving yet. So it's like what I call the gray area. So that's when it was really beneficial for me to have my Doppler, which I was really grateful I had, because I would use it at least twice a week, sometimes more. Just to like give myself some reassurance that everything was still good and all that good stuff. So, week 18 was the week of my birthday, and I was starting to get a little anxious because I still hadn't felt the baby move, and I still wasn't exactly sure where my placenta was, because one of my doctors told me it seemed like it might be posterior, and then another doctor told me it seemed like it was on the right side, towards the front a little bit more. So I was like, well, maybe I'm not feeling movement because my placenta's in the front. So, but around 18 weeks, almost 19, around 18 and a half weeks, I felt what I knew was for sure the baby moving. Like 100% I knew that's what it was. So at the time, I was using my Doppler, and I was laying kind of on my back, and all of a sudden, I had moved my Doppler over the center of my stomach, and I was just listening for the heartbeat, but I ended up feeling a little like, boop, and I could hear it on the Doppler too. And as soon as I felt it and like heard it on the Doppler at the same time, I knew, oh my gosh, I've been feeling that for like a week now, but I didn't realize that's what it was, because I thought it was like gas bubbles or who knows what, So, sorry, my dog's prancing around the living or the kitchen. So, so that was really exciting. First time feeling the baby move was definitely probably around 17 weeks, but not until I really realized in 18 weeks. And then ever since then, I've been able to tell when the baby's moving. The baby is still not even a pound at this point, so the movements still are not very strong. I only really feel them every now and then. I don't feel them like every 5 minutes or every 10 minutes. I feel them probably at least 10 times a day, well, I would say. But it's only when I'm really paying attention or I'm sitting super still, being really quiet and relaxed and stuff. I don't really notice that drinking anything cold or sweet helps him to move more. That's what people have told me, but I just think that my little dude doesn't like to move around that much yet, or he's just not strong enough that I can feel it. Because when I use my Doppler, I can hear him moving around, but I can't feel what I'm hearing. So it's either his position is too far away from my belly for me to hear it or feel it, or, you know, he's just not strong enough yet that his movements are really forceful for me to feel them. So, like I said, stop, get down, get your butt down. You cannot come up here. Excuse me, sir. Get your butt down. You are muddy. These animals. So like I said, the Doppler in these situations, especially for someone like me, has really helped to reduce my anxiety about not feeling movements like people have said I should feel. Now, because I'm 20 weeks, my OB did say if I'm not feeling movements really strong by about 22 weeks, that I need to come in for a checkup. Because she said babies' movements should be pretty noticeable and strong around 22 weeks. And we did find out at my anatomy scan that my placenta is right lateral, so it's a little bit on the front and right side of my... Oh, of course, right when I get the video camera out to film, the doggies have to be crazy. So anyway, that's basically my biggest update for the second trimester so far, is feeling baby move, which has been a really insane, fun experience, but a little bit nerve-wracking too, because once you do feel the baby move, you're expecting to feel the baby move like all the time. So then you kind of start to get worried if it's been, I don't know, a couple hours and you haven't felt anything. So I just try to breathe and stay calm. Hey, quit. So, sorry about the clap. That was loud. The other thing I was going to talk to you guys about was my anatomy scan. We ended up having it at 19 weeks because of my husband's work schedule. And with coronavirus, this was the only ultrasound my husband was actually able to be at. So I wanted to make sure that it was in line with his schedule and like what he would be able to do and make work. So I wanted to make sure he could be there. So that's why we did it a week early instead of waiting till 20 weeks or 21 weeks. But I was glad we got it done. I was really anxious about it. So we had it done at 19 weeks and 2 days. Currently I'm 20 weeks and 2 days, so it was about a week ago. And everything came out absolutely perfect. There was no concern whatsoever. We got a couple of photos. So we already knew we were having a boy, but we got this photo. So that confirmed that. So these are his little butt and thigh, back of his thighs, and then the middle obviously is the male parts forming. So that was fun to see that. I'm like, whoa. I just wasn't expecting it to be that obvious, but and then we got a little picture of his foot, his little toes. You can see all his toes. And I think he has my feet. And then We got two pictures of his face, but he was in a weird position. He was kind of facing my back a lot of the time, which is another reason why I think I don't feel him very much kicking, because I think he likes to have his like back and his butt against my belly, and then I think he likes to face my back and kick that way, because I get actually more back pain and like pain in my bladder and stuff like that. So I think that's kind of the way he likes to be. He's always really low too. He likes to be down low, even though my uterus is now at about my belly button. He likes to be way low. So this is a photo, a profile of his face, where he's got his mouth open. They couldn't tell me if he was yawning or if his mouth was just stretched open like that. But you can kind of see like his nose, his eyes shut, and then these are like the bones of the roof of the mouth and the bottom of the jaw, and then his lip right here, and then it's open, and then that's his bottom lip and chin. And then his little arm, you can see his ulna and radius, which are the two arm bones, and I only know that because I'm a PTA, but these two bones kind of came up, and I think his hand was resting like right on his face. So I think that's what we're kind of seeing here, is like some of his fingers and stuff. But yeah, so that was pretty much the best picture we got of his face. He never turned like forward so that we could see his actual face, but with 2D ultrasound, it's nothing really special anyway. The front of the face, it's kind of creepy actually. It kind of just looks like a skeleton. So yeah, but it was really exciting. Like I said, my husband was able to be there. I did have to have a little bit longer ultrasound because baby wasn't really moving like into the positions that they needed him to be able to see his heart chambers, which is a really important part of the anatomy scan. So eventually he did move enough after I twisted and turned and flipped and stuff. And actually I ended up on my left side for like half the ultrasound, because in that position he would move away and he would get away from the side, and then they could see the four chambers of the heart. So yeah, the things that they look for the most in the anatomy scan is the heart. They check the heart rate, they check the rhythm and everything, make sure it sounds normal. They don't do an echocardiogram unless you're an IVF pregnancy, which it's just funny to me because, I mean, I got pregnant 2 weeks after a failed IVF cycle, so I don't really know what the significance is of doing the echocardiogram for IVF pregnancies, and then not one that was still fairly close in time to the IVF transfer. So I really don't know how they determine that. Maybe it is the process of in vitro fertilization itself that causes them to have heart issues, and so maybe that's why they weren't worried about it. But yeah, so they did just a regular view of the heart. They did 3 different angles, so they saw all 4 chambers and the 3 vessels of the heart. I believe they looked for the aorta, the pulmonary artery, and one other, I'm not sure. So those were all normal and looked healthy and good. She showed us like the blood flow through all the chambers, red and then blue for the different arteries and veins. And then we saw the umbilical cord, which is something I was really like wanting to like get a firm answer on. So the umbilical cord, a lot of times people will only have two vessels, and it's normal to have 3. It's ideal to have the 3 because normally umbilical cords have 2 arteries and 1 vein, and the arteries are what carry the oxygenated, good Lord, blood and nutrients to the baby through the placenta. And then the vein is what carries waste away from the placenta and from the baby and back to the mother so that her body can flush it out, normally, because the baby can't do all of that stuff just yet. So when they only have 1 artery and 1 vein, they're not getting as much nutrients. They can still be fine, but a lot of them will have issues with intrauterine growth restriction, like low birth weight, early preterm labor, things like that. So that was something I was really not concerned about, but I just wanted to know if we did have a problem there or if it was normal. Turns out we have 3 vessels, 2 arteries, and 1 vein. So it looked good. He was measuring actually 19 weeks and 5 days at the 19-week 2-day ultrasound. So he was a few days ahead of schedule in size. So they told me he was in the 75th percentile, which they look for them to be 50% or above. What else? My placenta. Told you the position of that. They also looked at the placement of the cord into the placenta. So it's where the umbilical cord attaches to the placenta. Sometimes it will be in the middle, like right in the middle, which is an ideal position. Sometimes it will be like off to the side a little bit, and normally that's not a problem, but if it's too far off to the side, it can become an issue as the placenta grows with the baby and for the baby. So, yeah, my umbilical cord was directly in the center. Get down! No! My umbilical cord was directly in the center of my placenta. So she said it was just slightly off to the right, just a tiny bit, but it wasn't like drastically, if your placenta's here, like if this is your placenta, my cord, instead of being like perfectly center, is like maybe like that. So she said it's still an ideal position for nutrients and stuff, and clearly because the baby's measuring a little bigger, not much, but a little bit, that kind of confirms that it's getting everything it needs at this point. So they did measure my cervix. That's another thing I was a little bit worried about. My cervix, they didn't actually tell me the measurement. I think they don't like to tell people the measurement because they don't want people obsessing over the measurement. But they told me it was nice and long and closed. So that was a relief to hear, especially with some of the complications that I had in the first trimester and being on pelvic rest. And hey, can you guys like go somewhere else? You're making a lot of noise. Quit. Get down. Get down. Stop. Stop. So, yeah, hearing that my cervix was good and closed and shut was good to hear, because obviously that's really important for the rest of the pregnancy, because you want your cervix to stay closed so that you don't go into preterm labor or, all right, enough. They don't do this unless I'm in here trying to do something. That's when they do it. So, what else? Baby has 2 kidneys, which is good. It's obviously normal, but some babies only have 1 kidney, which can pose problems later on down the road. And our son does not have that issue. He has 2 kidneys. They looked at his brain. He has both different sides of his brain forming. They were able to look at the cerebellum, the brain stem, and the spinal cord, and everything looked good there. The spinal cord, they look at the end of the spinal cord and to see if there's any like spina bifida or any openings or anything like that, and it looked like everything was fine. They checked all 5 fingers and toes on both hands. They said they counted 5 fingers and toes on both hands, so that's a relief as well, because sometimes if they have an issue like that where they have an extra digit or they're missing a digit, it can be indicative of some kind of other abnormality, and a lot of times it coincides with heart issues. So it was good to see that they didn't have any issues there. I'm trying to think if there was anything else. I don't think so. So from this point on, I'm officially halfway through the pregnancy. So the countdown to baby is getting shorter than the amount of time that I'm pregnant, which is a nice change, because before it was like, oh, you're 12 weeks pregnant and you have 20-something weeks to go. Well, now it's like, oh, you're 20 weeks in a couple days and you only have 19 weeks to go. So it's like, okay, I can manage this. Not that I'm super uncomfortable, but the closer I get to number 1, viability, which 24 weeks is technically considered viable, but I think I'll feel a lot more relieved once I get to around 28 weeks, because most babies born at 28 weeks can survive with limited, they'll still need NICU for sure, but they will have a less chance of disabilities and difficulties and less chance of, passing away after birth and things like that. So And of course, normal people don't think like this. They don't think about that stuff. But when you've gone through infertility and treatments and loss, it's just something on your mind. And for me, I know too much from like everything I've seen. And I'm in a lot of groups with women that talk about this stuff. And so for me, I'm like, I just know too much. I wish I knew less, honestly, because sometimes ignorance is bliss. And I think during pregnancy, ignorance is probably bliss. So, what else? I think that's pretty much it. So from this point on, I'll be having an appointment every 4 weeks, I think, until I'm around 30 weeks, I believe. So I'm having one at 24 weeks, so in a month I'll have another appointment. And then she said at my next appointment, they'll be discussing like how to prepare for the third trimester because my third trimester starts at 28 weeks. So 2 more months until the third trimester. But yeah, reaching the 24-week point, I think will be relieving, exciting, and just kind of like, okay, we're on the last half of this. It feels closer to the end than it did at the beginning, and I think I'll feel like better about starting my nursery and stuff because I haven't started really my nursery yet, which I know it's still really early to start a nursery at this point. Most people don't even do it till they're like 30 weeks, but I am just one of those people that wants to get things started, and I like to be like super, I don't know, proactive and get things done in advance, especially while I'm still feeling pretty good and not like ginormous, huge. So yeah, but yeah, so I'm just waiting. Pregnancy is just waiting and hoping to get to the next milestone and trying to not stress and trying to enjoy every day and thank God for every single day. I literally do. Every day I pray and thank God. Thank you, Lord, for another day with our son. Thank you for letting him continue to grow and his heart's still beating strong and he's healthy, and just praying to keep me healthy. And I've been trying to focus really a lot on my diet, making sure that I'm eating well, getting enough food and whatnot. One thing I will say is I am still taking a half tablet of Unisom every night for my nausea because I tried to stop taking a half tablet 2 days in a row and I woke up feeling sick both days the next day. So I really didn't expect morning sickness to last this long, like into the 20th week, but if I just take half a tablet of Unisom the night before, I don't feel sick in the morning. And Unisom has been considered safe, so I really don't have a problem taking it, honestly, through the rest of my pregnancy if I need to, because number one, it helps me sleep, and number two, it helps with my nausea. And if I can reduce nausea in the morning and be able to eat a healthy breakfast and get going on my day and stuff, then that helps a lot. So, let's see. I think I experienced my first Braxton Hicks contraction that I could actually feel last night. It was like my whole belly just kind of felt tight and pressure, and then it would like subside for a little bit, and then it would kind of, excuse me, it would start again, and then it would subside a little bit. It didn't hurt at all. It just felt like a tightening. It didn't feel like a cramp or anything like that. It just felt like tight muscles, and like I could feel that my stomach was like hard, and then it would kind of slow down. And then I've been getting a lot more pain near my ribs as the bump kind of grows up more. And I have a really long torso, so there's still a lot of room for baby to move up and grow. But I just wanted to like share with that with you guys, because it's kind of something that if I sit too slouched, especially towards the end of the day after I've eaten a lot and like my stomach's a little bit bigger, I get a lot of pain like right underneath my bra line. So I think sitting up straight, having a good posture helps. I also did purchase if I can get it. I sit on this. It's a little like cushy. It's like a Tempur-Pedic kind of feeling, but this has been a really great thing for me to have, because when I would just sit normally, like on a hard chair or something, my pelvic bones would just feel ugh, and then like this helps my posture to be more straight. So I think it's a good thing to invest in. And the other thing I bought is a shower chair, and you're probably gonna laugh at me, but I know I'm only 20 weeks, but standing in the shower for 30 minutes, doing everything, washing my face, trying to shave my legs, it's like exhausting. Like I'm like, oh my God. So I bought a shower chair, number one, so that I can lift my leg and put it on the chair when I'm shaving, because otherwise shaving my legs is not comfortable. It's like impossible. And or if I want to just sit in the shower and kind of just let the water hit me. I've been doing that. it's really relaxing. And I do take baths like once a week. It's not like super hot, so it doesn't do much for me, because I really like my baths hot, and I can't take hot baths during pregnancy. So for me, it's kind of like, you know. But yeah, so I will show you guys. You might not be able to see it very well, my bump right now, because of my shirt. It's black. But yeah, so this is the bump. This is 20 weeks. I just started noticing, like, for sure that I can see, like, the separation right here of, like, my side muscle, and then where it's kind of stretching, coming down here and coming forward. So this is from the front. I did change my belly button piercing to a pregnancy one that's plastic, and it, like, stretches with your belly. And then here again, the side. So, but yeah, I mean, the pain that I've been having is mostly like here, like the stretching pains, or like on the sides right here. But yeah, for the most part, I mean, people tell me I look like I'm more than 20 weeks. I mean, I don't know. I feel like I look 20 weeks. I mean, I'm halfway through. But yeah, I did buy some maternity shirts, which are really, really comfortable. And then another thing that I've been trying to do is I did buy some maternity leggings, because regular leggings were getting way too tight and it was very uncomfortable. So the maternity leggings just go up to like about, you know, here with the band, and it's loose, so it doesn't feel like it's squeezing your belly. So I really appreciated that. But yeah, so I'm thinking what I'll probably do, because I don't know that I'm going to have a lot more updates from 20 weeks until my third trimester. I think I'll probably just do another video around 28 weeks and kind of let you guys know how, like, the last part of the second trimester went. I'm sure I'll have a bigger bump by then, and just kind of like how the doctor's appointments are going and kind of what they're doing to check me and whatnot. And if I do have anything weird or different or interesting that happens, I will definitely post another video before then. But other than that, that's pretty much all I have for you guys. So feel free to comment down below if you have any questions, or just to say hi, and I will see you guys on the next one. I hope you guys are all staying healthy, because coronavirus is not done. She is coming back. She is on the rise in Michigan again. It's not good. We had like 3,400 something cases in one day, which was the most that we've had in a long time in Michigan in one day. And the week before it was only like 1,000 something, and it went up 1 week later, 3,000 more cases in one day. So Michigan has been tough. Our governor has shut down a lot of stuff, which I understand, and it's good. We are really just coming out of the lockdown, kind of, and we still have to wear masks everywhere, but the lockdown, I think, will be coming back. I'm almost 100% sure the lockdown will be coming back. So everyone just stay healthy, be smart, do your social distancing, wear your mask. I know it's annoying, but especially when you're pregnant, it's a little scary, especially because flu season is coming around and allergies, and it's just like, do I have the flu? Do I have coronavirus? Like, so I've been just staying home. I'm not working anymore. I was working in healthcare, and I'm not working in healthcare anymore. I actually quit my job. Number one, just because I just think it's really scary right now working in a hospital, working in, healthcare in general. And so I just decided, and my husband decided, like the next 4 or 5 months of pregnancy, just take it easy, stay inside during the flu season, not really go much places, which it stinks, but, just to keep myself safe and everything. And we're taking lots of precautions. And I'm healthy and everything, so I don't really worry that I would be like severely affected. But when you're pregnant, your immune system is a lot different than when you're not pregnant. And I just don't know how my body would react to coronavirus. So I really want to avoid getting it if I can, especially while pregnant. So, again, now I'm rambling. But so yes, everyone just stay safe, stay healthy, and I'll see you guys on the next one. Take care.